introducing new hair loss treatment for women and men that may help to regrow and thicken hair without surgery, drugs, or expensive ointments. Just look at these before and afters. Doctors who use it say the secret is something you already have: platelets in your blood.
Platelets have growth factors in them, and they're very, very good at getting hair to regrow and getting the hair follicles to thicken.
It's called platelet-rich plasma therapy, or PRP, and research is preliminary but promising. While the procedure is not yet FDA approved, doctors who use it say it's simple. Blood is drawn, the plasma separated in a machine, and platelets from the patient's own blood injected directly into the scalp. She noticed a difference, and here she is after 5 treatments.
I feel the hair coming in, I feel the thickness. I love the results.
Let's talk to Dr. Jen Ashton about this. Those before and after photos, pretty remarkable.
Yeah.
What do you say to people who are dealing with this?
First of all, this is incredibly upsetting, so that we really need to be empathetic to them. The other thing is, I say be patient, and let me show you why. It has to do with the science between the life cycle of a hair follicle. Think of 3 stages. First one is anagen. This is really the active phase. 90% of our hair is in this phase. This is when it's growing. This phase lasts for about 2 to 6 years. Next phase is the catagen phase. This is transition, lasts a couple of weeks. A minority of your hair follicles are in this stage. And then the final phase, telogen phase, this is the resting phase, and this can last up to 6 weeks. So you can see with this timeline, if you start a therapy today, you might not see result for a couple of months. So you do have to be patient. But the science behind how PRP is thought to work is pretty cool, George, and let me show you what I mean. If you see regular thinning hair, you inject these growth factors directly into the scalp. It does several things. It increases the diameter or density of the existing hair follicle, recruits new growth, and it's thought to even prevent the existing hair from falling out.
For the last several years, she's noticed a change she's been unable to control: the steady loss of her hair.
I noticed a tremendous change. Even using the topicals and the lotions and the potions, it was just getting increasingly thinner.
After trying products like minoxidil, Terry decided to undergo a new and still unproven treatment derived from her own body.
Is it stinging a bit?
At Revive Med Spa in Millbrae, Dr. Gail Misley takes a sample of Terry's blood, then spins it in a centrifuge to extract what's known as platelet-rich plasma, or PRP.
What we're hoping for with the PRP is to provide a patient with their own growth factors from their platelets. And these growth factors will stimulate hair growth and decrease the loss of hair.
After removing the concentrated plasma, Dr. Misley injects it directly into Terry's scalp. She says she's used the technique to treat both men and women with early signs of success.